We really enjoy the orthodontic piece here. It's a growing part of our practice because a lot of people will contemplate doing Invisalign even for 2 years, and all of a sudden they're ready because they have a reunion or a wedding or something coming up. It's something that the team really rallies upon because, let's face it, a lot of the dentistry we provide people aren't looking forward to. And it's very nice to have that, especially with Invisalign, where you can see the results and they can go on, we can show them online, like, this is your point A, this is your point B, here's what we expect the transition. They can kind of follow along. Well, I have 20 aligners and I'm on 14, I'm almost there. Or this tooth that's driven me crazy since I was a little girl is now in the position that I always hoped it would. And so as dentists, we're exacting, we want everything perfect, but with a lot of these orthodontic procedures, you realize, like, if you just correct that thing, you've made that person's day, or more than that, because you take somebody who can't smile because they're ashamed, because there's something unsightly or something that maybe even as a teenager somebody made a comment on, and you correct that for them, you change their life. I'll see it all the time on the pre-op photos where it is almost impossible to get certain people to smile. They don't know how. They're out of habit, and a lot of that is because of shame, and you correct that for them, and you see how that their whole personality can really change with any sort of cosmetic dentistry. But Invisalign is near and dear to my heart because I've been an Invisalign patient myself. I like their philosophy. I think it's conservative. You don't have all the brackets and wires to really, it can be hard to clean around. Sometimes you can find it, degraded tooth structure once you take the brackets off. That's not fulfilling for anyone. You have perfectly straight teeth and now you need fillings underneath the brackets and bands. So it's something that we're always talking about in the practice with patients. Certainly, some patients will ask them, are you happy with their smile? If they rate their smile 8, 9, or 10, well, we don't have a conversation. But if you are a 4, 5, 6 or less, I feel like Invisalign and orthodontics should at least enter the conversation, because that investment in time and resources is hard to beat.